we are, Renee. Has there changes on the horizon here in Iowa?
Oh man, there's always changes going on in Iowa again and again in the mental health world. We're making big strides and new changes, and we've got a good one to talk about today. But before we dive into that, it is February. What's happening on the farm still in the middle of winter?
I just took a phone call. We're trying to haul grain, but there's a small spot that maybe wasn't completely dried when it went into storage, and so now we're having trouble pulling grain out of the bin. It's not going well. So I'm leaving here momentarily to see, assess, figure it out. So this is one of those bad days on the farm, Renee. Things
Uh-oh.
just aren't going. Semis are backed up, waiting to be filled. Yeah, it's fantastic. The day of a
Uh-oh.
farmer, right there. Day of a grain
Yeah.
farmer that didn't quite store the grain right. I guess it's a learning opportunity.
So just because I'm nosy, is that the new drying bin that you were working on
Yeah,
last year?
yeah, no, that's the new storage bin. So, went
So
through a
the new
drying
bin
system,
didn't
the new,
dry according to how it's supposed to,
well, it
so
could have been a
let's
user error. There was some user error at the front end of that whole
well, it's a
thing.
new system, so I'm
It's a
guessing
whole
there's
new
probably
system. So it's warm
yeah,
out today. We're drying. So we got fans on today. Hopefully we can loosen some things up.
yeah.
The answer, the solution from the Vin guy was you just need a 20-foot piece of rebar, put a washer on the end and poke it up and down. Don't put holes in the floor and loosen it up. That's
That's a
that's
really,
the
really
answer.
tall bin. Does he know how big that bin is? Because
Yeah,
that
he
doesn't
built it.
sound well,
Yeah,
that
so you
doesn't
gotta
sound very smart.
you gotta get in there and loosen it up.
Oh boy.
Yep.
Well, hopefully today's episode, we're not talking about the rebar that we have to use to break anything for the mental health system. Let's hope. But we had a new bid went out for everybody in our state, and Iowa has been in regions now for about a decade. At least the conversation was in order for it to have been, and they went live in 2013. So it's a little over 10 years now. And now, instead of that, we're going into districts. Administrative service organization is going to run districts. And so it's a different map. We always need new maps that don't match any other maps. We always talk about all this. And so today we're going to just dive into some of the things that are coming up that's interesting that people ought to be made aware of. So the notes today are going to be really important if you are following Iowa or if you are one of the lobbyists that are from the area that come in. Sometimes you're going to want to see some of this information if you haven't seen it because it's going to be good to keep you on time with what's going on today. So kick us off, Jason. What started out new in Iowa with this administrative services organization bid that occurred? What happened?
Well, the bid was announced in late December. We were expecting it by December 31. It came out early. And one statewide organization was awarded the ASO contract. So they are the statewide ASO, not just in those districts, well, obviously in the districts, but also got the whole kit and caboodle. So congratulations, right? I think congratulations are in order to the Primary Care Association for getting that bid, kind of changing things up because it kind of has a new entrant into how we manage our behavioral health system, kind of that doesn't necessarily have a lot of track record in behavioral health, more the federally qualified health center space, primary care space, and now merging that and that expertise with managing our behavioral health system through those districts.
Yeah. And for those out there that don't know, this is a really big shift in the thinking of how to do behavioral health. But in one hand, I know that it's scary, and we're going to talk a lot about some of the changes. But on one hand, what's really exciting to me is that now behavioral health care is part of mainstream healthcare. They have the Primary Healthcare Association, who really is the primary provider of that main level mental health services, who give out the most medications for behavioral health across the entire state. They now are joined to the rest of the system in a way that at least has oversight into all of it. You'd hope has data into all of it at some point where you can see all the people. And so a person now isn't separated from going to their primary care doctor and then having to jump into a behavioral health system. Now the vision is that that'll be one and the same. And so that primary behavioral health care now is healthcare. So from a vision perspective, this is really, really exciting. Where it gets sticky, and we're going to chat a lot about this, is the details. And so one thing you're going to want to look at today, if you've not seen the winning proposal, Jason, you read through that. What are some of the things that really stood out to you as why you saw that this would be a win? I mean, what did they do? I mean, I heard they didn't even have to have presentations by other organizations because this one scored so much higher than everybody else. And so, what about this was such a great proposal?
Yeah, I mean, my conversations with staff at DHHS really liked the vision that they set forth of really
Yeah.
integrating healthcare, finding a way to do that. I think managing the network the way we've seen physical healthcare managed really moves behavioral healthcare and puts behavioral healthcare on a new plane. So I think those concepts were interesting. I think, I think there's challenges with just flipping a switch on July 1 and
Mm.
seeing that happen because that's going to be a big change. And I think that's going to be a tough lift for a lot of smaller behavioral health organizations that maybe just aren't as prepared and as stable as I think the state believes that they are. And I think that's some of the things that Primary Care Association is going to figure out as they go through this process, as they provide some coaching. It's very different than the primary care network and how that operates and how that's, really been supported over time.
Yep, and we're going to talk more about data as we go along. But one of the big things in behavioral health is a lot of primary care groups do not have a good data collection system, and it's definitely not centralized. And you could see that before with regions not being able to get data that they needed from different providers, or especially like individual providers or people that are in small groups. They don't have that kind of technology to have data that pours into a central system. So I know one of the selling points of Primary Care Association is they had this statewide data system. That's awesome.
Mhm.
But if the behavioral health providers don't have a way to tap into it or to get their data into that in some way that is cost effective or even possible, they're going to be lacking that data still. So even though you have a statewide look, we've never had a system where we've had data from all behavioral health in one place. There's been lots of efforts at that. You've had some pieces, so like community mental health centers did a little bit better. Things, groups that were with like the county of supervisors association, that they had some data points, but there were certain governmental levels of providers that would pour their data into that, but it was never the independent providers, never the smaller providers. And so as we're also weaving through a lot of new providers with new CCBHCs, those community health centers, and being developed and designed, it's a lot of moving parts to try to get data. And I know Jason and I have had this conversation, but a concern we have is that, you know, legislators who, want this to happen 6 months, a year from now are going to be like, show me the data, and it won't be. So I know, Jason, you had some other thoughts on data and what we might or might not have.
Well, I mean, I think everybody you talk to, everybody knows data is weak, and it's going to take time to create a data set and be able to harvest usable data that can actually reflect the effectiveness of the system. And, I think, we're going to shift into talking about rules and the rules that are coming out from this. That's the shortest section still, right? That you can see people are struggling with data. We know that data is going to be a real challenge as this is implemented. There's so many other parts to be implemented. We know data is going to be kind of the second, it's going to be put on the back burner here, for a little bit, but how quickly is data going to be able to be pushed forward and
Yeah.
do something meaningfully? And will it be funded so that data can be harvested meaningfully? Because that's not just going to happen because there is no infrastructure in place today,
Right.
period.
And so the next big chunk we want to talk about are the new rules being introduced. And that's also in the show notes. If you're not aware of the rules, you need to be aware of the rules because there is a timeline on which you can get feedback in. There's going to be a public hearing coming up on February 25th that you might want to be part of if you want to hear about it. There's going to be two public hearings on April 8th coming up. And all those details, we have the slide deck attached here where you can get in there and see those dates and be able to be part of those public hearings to give feedback because the access standards are going to be interesting. So let me give some background on access standards. So when we put into the law a decade ago plus now of that we were going into regions, one of the things that was just mind blowing to people was access standards. We had zero prior to that, and every county could do their own thing, and there was no guarantees of how long for service or different times of services or things like that. So the very first attempt at access standards was now over a decade ago, where we put into the law that we wanted to get people places, and we tried based on things like inpatient, things like residential care, making sure that if you drew circles around them, how many miles were between them and those kinds of things. So there was an effort made. The very first thing I'm going to say before we even dive into these standards is you can tell by the fact that they're loosening up standards that they were not working. And if I were have been an existing region under the more tight standards, I might be kind of mad about that now because now they're giving you a lot more time to respond in many, many cases. We'll try to walk through some of these and talk about them specifically. But to me, it looks like they're giving more miles, more distance between services, which if I am a user of the system, that's not what I want to hear. And it's not going to help me get services better or faster. And so, from me, the legislator who was trying to get access to Iowans, this feels like we're rolling backwards. But let's talk about maybe why we're getting here. So, Jason, you saw the access standards same as I. What are some of the ones that stood out to you that maybe changed or are different or even maybe new that we've never talked about before?
Well, yeah, I mean, and I think part of me was like, well, maybe they're more realistic. I mean, kind of to
Yeah.
counter your point of like nobody was held accountable to these access standards in the first place. There was a lot of areas in rural Iowa. Currently an assessment had to be within 45 miles rural, 30 miles urban. What did that really mean? It was kind of a meaningless standard in a lot of ways. And so, kind of when we look at the mental health screening, assessment, diagnosis, crisis planning, everything went to 60 minutes, 60 miles, no matter if you're urban or rural. They just kind of did a standard. Hey, if you're within, and it's Iowa, right? So we pretty much think of it, it's an hour to go 60 miles, right? That's kind of how we just talk, across the state. And so thinking about, is that reasonable? Does that make sense? Mobile crisis response stayed the same at 60 minutes. Well, that was a struggle in a lot of spots already. So I'm really not sure as I look at some of these, as they've been set. Some of the ones that were reset, I'm not exactly sure why. Some of the ones that weren't reset, I'm not exactly sure why or what folks were thinking when they did this.
Right. And so mobile crisis is one that we always struggle with because 60 miles, 60 minutes is hard to achieve windshield time in rural. But for people in urban, that's so slow. And you'll talk to police officers and folks who have to do immediate responses. And 60 minutes, by God, they can get in, get out, and move on with their lives well before that occurs. So just having a standard time like that doesn't help either side, really, because urban needs that to be much faster if they're going to actually take on an emergency situation. I had a really, this is a little off topic, but I wanted to share it. I had a really interesting conversation with our former police chief in Des Moines, and he was talking about how mobile crisis in Des Moines used to be just lay folks, folks that were crisis trained only
Mhm.
without police officers' involvement until they started doing welfare checks and started finding bodies. And all of a sudden, then they thought maybe that's not the job for them, and that maybe armed officers who are trained in all of that should be more involved. And so when we think sometimes about mobile crisis and who shows up, and we're thinking sometimes it's about, well, you don't want people in uniform to show up with somebody who's in a mental health crisis. Well, you also don't want to traumatize your staff that aren't prepared for the law enforcement side of things that have gone wrong in those situations where there might have been a suicide or a homicide, suicide, or all the different things. And so, we really made my mind kind of expand to the possibilities of what happens in those situations. And also, we don't want to put people in harm's way. A lot of times nowadays, there's a lot of guns involved in mental health crises, and getting somebody that's there to help hurt in that process is not anything that police want. So that conversation I think is really interesting. And whether it's 60 miles, 60 minutes, or anything, we're going to have to continue working in the space of mobile crisis because uniformed officers are trained differently than civilians and are signed up, if you will, for those bad things to occur. Where civilians, that isn't their intent, their heart, where they're at, that didn't want to be involved in those traumatic situations. That's not their calling. So we have to be thoughtful about what we think about that. So besides those, Jason, is there other access things? Did they put anything in code we don't think they've used before? Or do you think they're all just changing the ones we've had before? I don't know if there's anything new in
They,
here.
I don't think I noticed anything new. Some things, were left out, like subacute, just
Hmm.
because there isn't much when it comes to subacute. So that was purposefully left out, moving
Hmm.
forward. Some of the stuff shifted to be, to be set in chapter 24. And so although some
Hmm.
access standards are here, some areas got shifted, like 24-hour, 23-hour observation or crisis respite. So, there were some that were cherry picked out for whatever reason. Recovery supports, prevention education, those are going to be addressed in the district plans, right? So, recovery
Mm,
supports used to have that 30-mile, 45-mile
mhm,
rural, mileage. Now that's shifted to being addressed in the district plan. So I'm not sure how some things are addressed in the district plan, some things
mm,
aren't. I'm not sure what exactly had to happen to
mm.
make the cut, I guess, if you will. And so I think that's somewhat notable as I
Yeah.
read this.
Another
Otherwise, I
one you
just
and I
think of
talked
how
about
is how
was
is it going to be? Yeah, go ahead.
mental health, inpatient mental health. It's interesting to me. One, urban, 60 miles, 60 minutes. If you're urban, why would it take you 60 minutes to get there? And then do you
Traffic.
really have mental health inpatient 90 minutes away from everybody in our state? I don't know
I
that
don't
I know
have
of those places. Do
I don't
you?
know. I don't have the map. I need to go back and look at our
Hmm.
that the maps that show us that. Offhand, I would think there's certainly some parts of the state that wouldn't meet that. So, that's my other question, accountability in these things. Like,
Yeah.
what happens when you're up in the corner, or you don't have that accessibility? Is this truly, I haven't matched up inpatient facilities with this to really see, how those concentric circles look, when we look across the state. So, I mean, I think that'll be interesting to see what are the solutions in those cases. I don't know.
Yeah. Yeah, the other one that jumped out at both of us was that justice involved outpatient competency restoration, where it says it's available to all individuals statewide through the district. And well, that'll be interesting to see because that's not necessarily what's reality today. So that'll be interesting.
No,
And
no, that's not reality.
and this gives me the first glimpse of what districts are going to do that's different because we've all talked about why would they need districts if you have one ASO over the whole state? Well, in these access standards, and maybe is one of probably many things, but they get to have different standards on certain of these based on what their district is and needs. And if
Hmm.
you remember the district maps, two were created very rural to specifically not be attached to bigger communities on the east side of the state. And for those two, those access standards will look very different than when you have Johnson, Lynn, Blackhawk all in one big kind of urban district on the east side. So there is going to be a reason to have district lines, but I hadn't seen that before. So for me, that's a new idea. Oh, because everybody's saying, well, what in the world are districts going to do if they're all under the same? But there are some things already starting
Yeah.
to line out. But again,
Yep.
for those of anybody listening, you can get into this, see in the show notes, and make sure you know when these public hearings are coming up. These rules are supposed to be published by 14th of May, and this all goes live supposedly July 1st. So you need to pay attention. It's a quick timeline to turn around and get this done. So any other thoughts on those proposed timelines that you wanted to chat about?
I think it's quick, right? So it's a lot of reading to do. I've perused through, read all of these. And I just look at how quickly all of this has to roll out, be in alignment, the new plans that have to be written. It's just a lot of stuff. And I just always worry about what falls between the cracks in that first year, because that's always what happens when you have something moving along so fast and it can't slow down. But there will be pieces and parts that get left behind. And so, making sure that those things are picked up as quickly as possible, I think is going to be really important.
I agree. I agree. And I also think primary care association is going to need a little grace with understanding what they fully took on in this bid. I mean, they wrote a great bid. Congratulations to them being in charge. I mean, we hope to have some representative from their organization able to come on the podcast here in the future and be able to talk to us more and answer some of these questions that we still have. But I'm guessing right now they're still in the contract stage of working with HHS and getting, just getting their feet on the ground. So we're going to have to give them a little bit of time to get up and running. But that is our intention to bring you more information about that straight from the horse's mouth, if you will, so that we'll know more about that in the future. So, yeah, it's a really quick timeline. Be interesting to see, to your point, if they make the standards, how are they going to measure the standards? And that's been a piece that's been missing in the regions ever since we made the standards. We made the standards and they looked good, but did we actually ever meet the standards? Again, this goes back to our favorite topic, gold stars on a map. There would be, it exists in the region for one person, one place somewhere, and therefore it counted. And that is not
Mhm.
the intention of these access standards. The access standards is for all Iowans to have access within these timelines. And that was not happening before. And so we shouldn't just jump to, oh, it's a new system, new ASO. So now these standards are going to be matched. Probably not. It's going to take some time and some development of some partnerships and some different things to get some of these services up and running in places where maybe they don't exist. All right. So the last thing we're going to talk about before we get out of here is recovering politician self-care policy of the week. I've had a couple of really rough weeks, and I was thinking about a couple of things. Since we have podcasted last, the Surgeon General came out with an interesting report about how alcohol is causing cancer. And they apparently knew this back in the 80s and didn't really talk about it, but they want to put warning labels on all of our products to say that they could cause cancer. And I went looking to try to figure out which cancers things are related to, and I couldn't really find a list, but I'm going to keep looking for that. But in the meantime, I started thinking about drinking. And it is January. Lots of my friends are doing, or it's February. Sorry, we just got through January, and a lot of people just are finishing up their dry January, or at least we're attempting a dry January. Don't know if anybody listening did that. But thinking about like our relationship to alcohol. So why it applies to me today is I was thinking about I had a really rough week and I was really, really angry about a particular situation that did not go down correctly in so many ways. But people around me are like, oh, just go get a drink. Oh, just go, get some shooters, go get some, shots and do this and do that. When I am out of control feeling like that or really angry, that is absolutely the worst advice ever. I'm not going to feel better in that. And so at least I know that about myself today. I didn't always, but I do now. And so I think you have to be selective with your self-care choices. And you have to be, it's not necessarily a bad thing to have alcohol. I'm not condemning it. The Surgeon General would condemn it for you. That's not my job. That's his job. But I think that there's times that it's right and times that it's wrong. And so, working as I do in parole, the number of stories that started out with, I had this much to drink, and then potentially added like a Xanax or something to it. It's unbelievable, the number of people that now are in prison. And so, I don't need to be in prison. Nope. And so I'm going to have to make some better choices. So I don't know. That's just my thoughts of the week is like, I've got to look for other things. For me, that's a physical activity, exercise, something to get the energy out. I'm not just stuff it in with something else. Like food and drinks just don't help me when I'm in those kind of spaces. So I don't know, Jason, I didn't ask you, but do you have any thoughts about maybe the Surgeon General's warning on alcohol or any thoughts on any of this topic?
Well, I will tell you, after that event we went to in early January, I got sick, and it was because I was around people from all over the country. Well, actually, all over North America. And I got that cold that lasted about 10 or 15 days.
Eh.
And so I haven't had an IPA for it's been like 3 or 4 weeks now. And not only, and thank goodness for being sick, but I've dropped 10 pounds. So I'm a
Wow.
little healthier than I was. So certainly, backing off a bit. And so, IPAs probably aren't the healthiest anyway, especially, you know, and so it does make an impact. So, as you think about exercising and what you do, I think there are definitely some health benefits that, we all need to take a look and step back now and then and think about, well, what is probably best. And so certainly I think, looking at that Surgeon General report, the links to cancer is certainly a reason to take pause, especially, as we talk about when we travel, how much alcohol has increased. Alcohol use has increased across the board, and, especially with liquor now, and as we think about other substances. So, I think that it's important that we keep an eye on those things and think about, what are we doing, and is everyone aware of the risks that are involved? And so I do think there is an awareness piece to that is very valid.
Yeah, I think we should dedicate a future episode to this and maybe dive into to that Surgeon General's report ourselves and kind of pull out some interesting information that we can, because we do speak about it all the time, and maybe that's something we should talk more about is was we can help digest it so our listeners can digest it better. But that is our self-care policy of the week. And for those of you out there that are in the legislative session, just trust me, you don't need to be going extra hard on the alcohol either for any good reason. Bad decisions are made when that occurs. So today we talked about the Administrative Service Organizations, the ASO. There was a bid in Iowa that was won by the Iowa Primary Care Association, and big congrats out to them for winning that bid and the fact that it's going to be implemented July 1st. So there's tons of show notes today about what their bid was, if you want to see what they proposed, about the rules that are being proposed and the timeline for you to have input if you're interested in that. And then just really talking about some of that data that they're wanting to collect with access standards and what your thoughts are on those things. So we look forward to seeing you next time. Have a great day.